So I was always one of those people that would say, people are just complaining about this, they're complaining about that. It's not really like that. You hear a lot of people say that the black community is not treated a certain way in the hospitals, and I had never experienced that. So I wasn't, I was leaning more towards, that's just people complaining. That's what I thought. However, when I experienced some things in the hospital myself, and with other people, and I'll give some examples. One was, and I mentioned this before to our community, was when my husband was in the hospital, and on several occasions. One time he was in the hospital, and they were giving him morphine, and he was so lethargic and so out of it. And they kept saying, okay, well, we can't let him go because he's lethargic. We're trying to control his blood pressure and all that. And I would go, I would stay there for most of the part, but I had girls, so I had to take them to school and all that. So whenever I'd go back, he was still just out of it. And one time when I was there, he was like, it's this morphine. He's like, I'm going to tell them to stop giving me the morphine. So they stopped giving him the morphine. And the next day he was up and back to normal. So that was one instance. There was another instance when he was there, and they were giving him something. And before they actually gave it to him, he actually told them, I've had an adverse reaction to this in the past. And they just kind of blew that off. Didn't offer anything else, but he didn't want to be non-compliant, so he just told them, okay, go ahead. So they gave it to him, and he was worse than when he was taking the morphine. But this time, he knew, okay, you know what, I'm going to have to take this, I'm going to have to go ahead and jump on this now instead of going days and days, because the last time he was in the hospital for like maybe 4 days behind the morphine. So after he was taking this medication for like maybe it was a full day, and he was just out of it. So he told them, look, I need this to come out. I don't want to keep taking this. And my husband, if they know him, anybody that knows him knows he's not going to put up with a bunch. He'll put up with it for a while, but then after that it's like, I don't even care. So after he told the nurse, and she's like, okay, well, I'll check with the doctor. 2 hours later, she hadn't been back. So he went ahead and pulled the IV out of his arm. Now, I don't suggest this for anybody, but not the IV, but he disconnected the IV, the bag. He disconnected that part. And soon after, he was up and moving around and, talking. And before that, it was almost, it was like he was in an almost vegetative state because he was just kind of out of it. And when the nurse came in, she was shocked, of course. It's like, and he's like, well, I was trying to tell you that this it had me this and that and whatever. And so she immediately changed the subject and started talking light conversation, saying whatever. And when she left, apparently she put in his chart non-compliant. And I mean, from that moment on, he was treated differently at the hospital. The doctor that came in, it was like he didn't even care about him as a patient. He didn't even really read his chart. I mean, because at that same place, they were trying to give him 2 additional medicine pills that he was already taking. It wasn't the exact same one, but it did the same thing. And thank God he knew what his medication did. He's like, no, you're giving me that, but I'm already taking this. And she's like, oh, okay, well, I'll check with the doctor. And then there was another one. Oh, I'll check with the doctor. And then come to find out, he was already taking something similar. So that instance, and then also there were 2 nurses that came in. They were, they were people of color. And they kind of whispered to him, something was put in your chart that you were non-compliant. So you're really going to have to take this into your own hands and be your own advocate, because they're really not going to look out for you. And And I'm not saying this is everywhere, this is just our experience. And I was really shocked because from that moment on, after that was put in this chart, whenever we would, and we didn't try too long, it was like we went back to that hospital later or whatever, and it was not the same. It was not the same treatment. He was treated differently. So we had to switch hospitals. We went to a different hospital where he was treated better. But that was our experience. And also, I had a niece that was in the hospital. When I was there with her overnight, things were fine. The very next day, I couldn't go. And when she was there, when I went to go visit her the next day, she was like, oh my God. She's like, I don't know if I can manage with somebody not being there with me that night, another night. And I was really surprised because they were so friendly and so helpful that when I was there. But when I wasn't there, she said it was like there wasn't a nursing staff there, not attending to her needs for what she needed through the night. And I think it's sad. I mean, it's unfortunate. And those are, there are other experiences where I had that were great. So I'm not saying all of the hospitals are like that, but all I know is if I have a loved one in the hospital, then I'm going to do everything in my power to make sure that somebody is there with them, or we're constantly checking on how their whereabouts, communicating with the staff, and letting them know, okay, somebody's there that cares about them, so treat them right. So that's my story, and that's why I feel like advocacy is so important. And because of the platform that we have here, I know that there are a lot of people that are by themselves. And just the fact that they're by themselves, if they go to the hospital, who's going to be there? Who's going to show the staff, the medical staff, that there's somebody there that cares about them, so take care of them, look out for them. So that is my experience on the hospitals, and I have more. I'm just not going to go into that details. So that is what our topic is about today. Let me give our disclaimer. This is a community call to educate the community about holistic healing. All the information and comments are the opinions or experiences of individuals unless introduced as a doctor, and we happen to have a doctor on today. Individuals on the call are not doctors, so please consult with your own doctor, or even better, do your own research and find out what works for your own body. All right, so today's conversation is about something many people are quietly living with, like chronic stress on the body, chronic conditions like high blood pressure, and the feeling of being unheard or overwhelmed when it comes to healthcare. We're talking about advocacy, not as confrontation, but as learning how to listen to your body, understand what it's asking for, and taking practical steps toward healing. It's not about fear, it's not about agency, and today we're exploring what that looks like, especially in the Black and Brown communities, with Dr. Jada Yvonne Lee. Now, she is the founder and she's the founder and chiropractor at Yvonne Chiropractic Incorporated here in Houston, Texas. She specializes in personalized, evidence-based chiropractic care with a strong focus on personal injury cases, including motor vehicle accidents and slip and falls, as well as sports rehabilitation and functional recovery. And it is such a pleasure to have Dr. Jada here. My daughter and I met her at an event, and I mean, she blew my mind. She's young, she's intelligent, she's got her own business. And it's such a pleasure that she's even able and has the time to come and meet us here and explain some of the things that she has learned and that she's sharing with the community. So thank you, Dr. Jada.
Thank you for having me. Good morning, everyone.
Good morning.
I'm grateful to be here and to be able to share my story. It's just another reminder that I'm living in my purpose. Before we even get started, I just kind of want to say I really don't have like an agenda for anything. This really isn't a lecture, it's more so just a conversation. And I wanted it to be real, I wanted it to be raw, I wanted it to be honest. Um, so
Awesome.
I also want to share my own personal story as well, just because me becoming a chiropractor wasn't something that I woke up one day and was like, yeah, I've always wanted to do this. Like I started in the classroom, yeah, I want to be a chiropractor. I think a lot of the passion behind what I do came from my family. So Yvonne actually is my middle name, and that was also my grandmother. She was kind of more like the big mama in the family, so technically she was more so my great aunt than she was my biological grandmother. So we're still blood, but kind of in a little bit of a different way. But she basically was like the blueprint for my entire family. And I ended up losing her to complications of diabetes. I think she passed due to heart failure. And it was something that really hit me hard just because she was probably like the sixth, seventh, eighth family member that I lost on my dad's side of the family by the time I was 15. Um, I feel like, as with all family dynamics, you can have complex relationships. So, my dad wasn't super close to his family, but whenever he had kids, he wanted us to know this is where I'm from, this is who we are, this is some of my upbringing. So, I felt like as soon as I got close to my grandparents, as soon as I really started to get to know everybody, that's when everybody passed away. So, I think I was like 6 or 7 when my biological grandmother passed away. I think she passed away due to a stroke. And then, probably about a year later, my grandpa LB passed due to brain cancer. And then right after that, I think Grandma Wiki, Yvonne, her husband passed to colon cancer. Then she ended up passing away to complications of her diabetes, and it just kept going. So for me, anytime I got a phone call or my dad did, and it was like, okay, this family member's in the hospital or they have to go to the doctor, I immediately associated that with death. They're about to pass. They're going to have this chronic illness. They're going to get cancer. And I started to kind of develop that assumption myself that, okay, one day I'm gonna get older. I'm probably gonna pass at like 50 or 60 due to XYZ. And that just wasn't something that ever really resonated with me. And I was so frustrated because I felt like there wasn't anybody who did enough. Yes, at the end of the day, we are in charge of our own health, but I don't think that the answer to everything is, okay, let's just throw this diagnosis at you and then let me tell you, you need to change your diet or you need to do this and then just leave it alone. Like, we need to have more providers who actually want to educate, who want to teach us what's going on with our bodies, get us to understand things, help us change a lot of different stigmas and beliefs that this is genetic because this happened to this person, this is going to happen to me. A lot of things can be prevented by um, just changing your life and viewing your health in a holistic lens. And ultimately, everything comes back to education and to advocacy. Um,
Yes, that is so true. I love that. Yeah, that is beautiful. And I know whenever I'm talking to somebody, I'm like, everybody has a story. There's a reason why they got into it. And so, have you noticed from since you got into it and the people that you've contacted with the information that you have you noticed a difference like in your family members or anything?
Yes, I think I have more of a sense of established trust with my family where before anybody goes to Google, before they call a doctor or anything, they come to me like, hey, can you explain to me what this is or what I was told and what do you think I should do? And ultimately, I've just been trying to teach them listen to your body. I can't do anything. All my family is in Missouri. I think I have a brother in California. So I'm like, I can't do an exam with you as a chiropractor through the phone, through whatever. You're also my family. But what I can tell you is I can give you some gems and tell you that you need to start moving your body more. You need to make this change, and this is why.
Yeah. So why did you go into chiropractic instead of like health or medical?
So honestly, if I'm being completely honest, I ended up enrolling in chiropractic school, not knowing anything about it, never having been to a chiropractor or anything. And I wholeheartedly believe that I was chasing a calling that God was giving me. I grew up probably at the age of like 5 or 6, I'm like, oh yeah, I know I'm going to be a doctor. That's what I'm going to do. But I didn't realize that I was going to be a specific type of doctor. I always assumed I was going to go into the medical field. So I ended up, following course to be pre-med, all of that. I think my freshman year of undergrad, first week, part of my diversity scholarship, we had to be in this association where they bring in other healthcare professionals in other fields to expose us. And I remember I immediately was like, man, I already know what I want to do. I want to be an orthopedic surgeon. I'm not about to listen to this. And God straight up told me, cut all that out and go sit in the front row. So I'm like, okay, it's like, let's in the front row. And they start giving this presentation on chiropractic. And I realized that I was more fascinated with the physiology of the body and the how and the why and the function behind everything rather than medicine. I really didn't want to be the provider who was like, okay, here's this pill, that's what we're going to do. I really didn't want to do anything super invasive. What I cared about was understanding the why and being able to break that down to other people. So then as I proceeded throughout undergrad, I'm like, you know what? I think for whatever reason, I don't know what chiropractic is, but for whatever reason, I feel like this resonates with me more. So that's what I'm going to do. And when I made that decision, my entire family was like, no, you're throwing the bag away. Like, what are you doing? Because they didn't understand that a chiropractor was still a doctor. But being where I am today, I definitely made the right decision. And I am glad that I listened to that intuitive nudge because I think I'm where I'm supposed to be all along.
I'm glad you mentioned that because back in the day, well, I noticed society treats chiropractic like it's not, a doctor, like you just said. Because I was watching, was it Two Men and a Baby, or I forgot what it's called, but it's the one with Charlie Sheen or Martin Sheen, whatever, one of the sons or brothers, or whatever. And it has the two brothers, and one is a chiropractor, and they keep acting like he's not a doctor. And when I'm watching that, this is after I learned how important chiropractic, services are. It helps with scoliosis. It helps with, different things, the way you're walking, your body. And when I learned that, I'm like, okay, wow, this is another instance where they're trying to act like the things that really help us is not significant. And so it's funny that you mentioned that because I used to think about that with that show. And also just just a lot of different shows, if you watch them, you'll see that they will downplay somebody that's doing something like herbalistic, or, they'll treat them like a flower child or something, some weirdo or something. So I'm glad you mentioned that because I would love for you to go in depth or, deeper into what chiropractic also covers, because we know it's the alignment, we know the adjustments, and they crack the neck, those kind of things. That's all a lot of us know. So if you can go into details about more things that chiropractic offers, I would love to hear.
Absolutely. I think a lot of where the disconnect comes with chiropractic is people just don't know. We only know what we see. And within the chiropractic profession, because it is the merge of science, philosophy, and art, a lot of people focus on just the art, meaning the adjustment style, the different ways that you see people getting adjusted. So a lot of people want to watch that. They want to hear the crack. They want to see all of the crazy moves happening, but then there's no education behind it. In those videos, there's no science behind it. So then people are left to kind of assume whatever they want to assume. Um, yes, chiropractors realign your spine. Yes, sometimes there can be a cracking sound that is produced from the adjustment, but that noise within itself is just gas releasing from the joint. And what we are doing is a lot more powerful than the adjustment itself. So, the reason why there can be all of these different crazy miracles that happen with chiropractic is because we are more so your nervous system doctors. I think there's a new wave going in general pertaining to health where everything is based around the nervous system. Oh, I don't want to do this if it's not making me feel calm, if it's not making my nervous system feel at ease. Chiropractic is the process of removing the dis-ease that is in the body and regaining your awareness of what's going on in your body. Say all of that to say, um, Your nervous system is your brain and your spinal cord. They work together. Everybody knows your brain is kind of the powerhouse of your body. You can't do anything without your brain. But the how is through the spinal cord. They the game of telephone. You have all of these signals that go through, and the spinal cord is what connects all of your organs to your brain. So that's why sometimes you can receive an adjustment and then, or you see somebody receive an adjustment and then they're like, wow, I got this miracle adjustment that ended up improving my digestion or that ended up doing this. It's not a miracle. Chiropractors are really good at analyzing, okay, you're telling me you're having this, and this going on. So your body's in a state of dysfunction. Let me go check out the lumbar spine, because this is where the nerves control your GI tract and control everything in your abdomen and in your pelvis and your reproductive organs. Let me go give you a very intentional adjustment. And sometimes you can have that miracle adjustment that happens, but it just kind of varies on the time frame of when everybody experiences that. So, all in all, it is a way to address the dysfunction that you're experiencing in your body. A lot of the times, people go to chiropractors when they're in pain, but by the time you're in pain, your body's already been in a state of dysfunction for a long period of time, and you've just ignored it up until the point where you started to finally feel that pain. So we tend to get a lot of people who are like, man, I've seen this provider, they didn't know what was going on with me. They referred me to this one. I've gotten this MRI, this x-ray, this, and nobody's been able to give me an answer what's going on. Sometimes chiropractors we have to swallow our pride and be honest and be like, I don't know what is going on with your body specifically to give you a specific like terminology of this is exactly what's going on, but I can acknowledge that your nervous system is under attack, that it is dysregulated, that you are experiencing dysfunction in multiple areas of your body, and I have the solution to help you. It's just going to take some time. So it's very powerful, and it's a very beautiful thing to experience.
Yeah, you mentioned the spinal cord, and I was just looking at some videos about the spinal cord and the spinal fluid and how important it is to our spiritual wisdom, and how if the spinal fluid is flowing up to the pineal gland, how it opens up different things, it decalcifies the pineal gland. Um, when you're doing chiropractic services on somebody, is that something that they experience as well, or can you touch on that spinal fluid?
Absolutely. I think one of the most powerful adjustments a chiropractor could ever give is going to be to your C1 vertebrae in your spine. That is your very first vertebrae, otherwise known as your atlas. And it is so important because it literally is the closest to your brain, right? The closest to all of those glands and important blood vessels. So I think the biggest emotional release that I have witnessed from an adjustment that I have given to somebody has come from that first vertebrae. I think the reason why we can have enhanced spiritual awareness and sometimes those out of body experiences from an adjustment is because the chiropractor, we are healing with our hands, and we have to be able to also hold that space for you on the table. So before we even touch you, we have to be able to separate what we have going on, all of our emotions, life, everything, and be able to tune into your body to be like, okay, this person on my table, they are feeling this, they're under stress, they're going through this. I can tell when people are carrying a heavy weight into the clinic and then they go on the table, and then be able to give them an intentional adjustment to an area that is in need that then can cause that. But sometimes it doesn't always happen off the first adjustment. Sometimes it happens on the 10th, 20th, 30th adjustment, or on the third. Like, we don't know when we are giving the adjustment that that's going to happen until the patient on the table starts crying and like sobbing their eyes or sobbing and bawling their eyes out. And they're like, what is going on? Like, I'm sorry, I don't know why I'm crying. And I'm always like, hey, you don't know what's going on yet. I'm going to encourage you to release that and let that go. And then from there, I'm going to explain to you what is going on in your body. You've been storing trauma in that area for so long that you've been carrying it for years upon years upon years upon years. Your body finally got to release whatever happened to you, that caused that emotional weight to be right there, and I helped you release it. So it can get pretty intense, pretty deep.
Oh, I bet. I bet that's an amazing experience for you as well.
Yes, yes, absolutely.
And I'm going to encourage those that are listening, if you have questions, to go ahead and ask, because as you're speaking, I'm thinking of all these different questions, on my own end. I'm like, ooh, I want to know this, this, this. But there's a question in the chat. How do our insurance companies work with chiropractic services? What do we need to do to get these services and have these services covered by our insurance?
So, honestly speaking, the majority of chiropractors do not accept insurance. I know I am one of those that is out of network with insurance, and it's not because I don't want to help as many people as I can. It is because the insurance companies try to dictate the level of care that we provide, and they'll tell us as the chiropractor, I can assess somebody, examine them, be like, okay, they have this disc pathology going on, they need, to start with this many visits, I need to be able to do this therapy, that therapy. And they'll be like, that's cute, we're only going to pay for 6 and you can only do XYZ. Well, the patient's not going to get any better. And then on top of that, we put in all this work. And honestly speaking, sometimes we don't get paid from the insurance companies as well. So a lot are out of network, but that doesn't mean that the chiropractic services are going to be so out of your budget to where you're never going to be able to receive them. You kind of have to sit with yourself and be like, okay, do I want to make this investment in my health to get my body better, to give it the TLC that it needs and the support it needs to help it function better and help me address all of these issues that I have going on? Or do I not want to make that investment? We spend money to go get our lashes done, to go get our hair done, to go buy
Mhm.
clothes, but then we don't want to go invest in our health because somebody doesn't take insurance. So I think it's just a matter of finding the right space, the right chiropractor. It's all about divine timing as well. And once you're ready to make that investment, then go make that investment.
Yeah, I
And
agree.
Beverly, some insurance companies pay for chiropractic. Mine pay for like 10 a year, and they pay for nutritionist and dietitian, but they do not tell you if you don't read or if you don't inquire.
What insurance do you have?
I used to have United Healthcare, and I went to 3 different chiropractors in Sugarland, and they covered up to 10 a year. And I would do the end of the year, and then I would start back the beginning of the next year. And now I have Blue Cross Blue Shield, and I haven't checked with them, but I'm told that they have chiropractic as well.
We have different provider networks, so you should be able to kind of pick and choose who you want to go to from the network.
That's good.
Yeah.
Yeah, I think they are getting better with holistic health. Some insurance companies are getting a little better, because I remember one time I went to a alternative medicine and they actually reimbursed me. So it is getting a little better. So please make sure you check with your insurance companies to find out what they allow. I do want us to cover the self advocacy. So, what would you suggest, like especially in the Black and Brown communities, for us to do as a community or as an individual for self advocacy in these different underserved communities?
I think the first question you should ask is, what is going on with my body? If the provider that you are going to cannot explain to you and break it down in regular people terms of what is going on to where you understand, then you need to go find a different provider, because that's going to cause a disconnect right there. I think a lot of advocacy stems from education, and again, I try to put myself in the shoes of, okay, If my grandmother were in front of me today and she were my patient, what type of provider would she have needed in order to, add on a couple more years of longevity in her life? So I try to think about that. But I think it comes down to what is going on with my body. What resources can you give me for me to understand what is going on with my body? And then from there, what are my options? Because you shouldn't just have just one answer like, okay, you're just going to take this one medication, that's it. We're going to do this one surgery, that's it. You're going to have this one treatment, that's it. You should be able to choose and advocate for yourself and be like, okay, yes, I want to do out of option A, B, C, D, I want to do option C because this is what I resonate with or this is what I want to do. Also, don't be afraid to ask questions. I encourage questions with my patients. A lot of the times when they start to realize, okay, wow, you are very knowledgeable, like I can pick your brain, they'll make comments. I don't want to ask a dumb question. And I'm like, there's no such thing as a dumb question. You're coming to me. I'm the doctor. I know this stuff. You don't. So you're supposed to ask whatever questions that you want, and you're supposed to feel comfortable with your provider to ask questions.
Man.
If you don't feel comfortable, then you need to go find a different provider. Yes, there's a small percentage of um, Black providers out there in contrast to our counterparts, but we do exist. And even myself, I'm very tapped into the network with other Black chiropractors. And from there, we are in network with other Black providers. We know Black orthopedists, Black dentists, Black dietitians. We know people in many different realms.
Man.
Have you, and I don't know how to ask this properly, but I want to know. So, you know a lot of black people in the medical field. Have you noticed a big difference in how they treat patients that are in the black and brown communities? Or are some of them sold into what the companies, the insurance companies, or the medical industries want you to do?
A lot of us share the same values for similar reasons, whether we were personally affected by a family who suffered from a chronic illness or whether we went through something ourselves. A lot of us see that and understand, okay, we are the 1% or the 3% or the 5% of Black providers in this realm. We need to make sure that we are providing healthcare equity and bringing value to our patients and holding that space for them.
Awesome, awesome. So if you get a chance, can you send me that list of those black and brown community? I mean, providers,
Yes,
because
I can try to make the list. So I know, like, when it comes to, I probably have a bigger list when it comes to Black chiropractors in different areas. And then I can try my best. I'm still working since I'm kind of newer in the game here in Houston. And my practice has been open for a little less than under a year. But I can definitely put together like a list and get that to you for sure.
okay, if you get a chance, that would be great. Because what I'm trying to do is work on a list of different doctors that our community can reach out to that would actually be interested in their health. Also, can you discuss how education, the importance of education on preventive, measures for blood pressure and diabetes specifically? What kind of things should we do to prevent these things?
Absolutely. I think the first thing is look into your diet. If what you are eating is making you tired, it's making you sluggish, it's making you not want to do anything, or you know for a fact, man, like I'm eating something that isn't good for me, frying pork chops all the time, eating lots of greasy foods, then you should change your diet because a lot of things can be prevented, but we have to take those measures early on. So, for example, if you wait until you are 70 years old to be like, okay, I ate like trash my whole entire life, and then now for 2 months, I'm going to try to eat clean and expect your body to reverse what has been going on that whole time. You're not going to have as good of results as you would have if you implement those changes into your life for 2 years, 5 years, 10 years, 15 years. So I think really being more mindful of treating your body like the temple that it is, and that it was created to be, and being like, okay, I'm only going to put things in my body that are going to feed it, that are going to nurture it, that are going to give it the nutrients that it needs to help it function, that's going to pour love into it. And when I say putting things into your body, that includes alcohol, that includes the beverages that you're putting in your body, that includes the food. Sometimes that includes the products that we put on our skin, or certain materials that we're putting on our body. And then also, the second most powerful thing is absolutely going to be exercise. A lot of people think that they need to, go run a marathon, or run sprints, or lift super duper heavy weights. Sometimes just light exercise, not even sometimes, all of the time, light exercise is one of the most powerful things you could ever do for your body. If you are one of those people where you do not exercise at all, I encourage you to just go walk on a treadmill, go walk outside 10 minutes. You don't have to speed walk. You don't have to be a Karen and try to go chase somebody down. You can literally just vibe and just move your body a little bit. That's enough to get your blood pumping, your blood flowing, to get your joints hydrated, to get things moving. That is very powerful within itself. And then there's also a lot of research that backs resistance training, lifting super light weights, or using resistance bands that can also aid your body and help to prevent things like osteoporosis, degeneration, arthritis, or if you do have those conditions, that can also help to strengthen your body and still keep things moving and functioning without further causing any damage.
Awesome. There's a service, something that we provide for the community, for the exercise. I'm glad you mentioned that because it's absolutely free. It's us working out in the morning, every morning, 7 o'clock, well, from Monday through Friday, 7 o'clock to about 8 o'clock. And we're just doing exercise. And it's, you could be sitting down during the exercise, but it's moving. It's moving. And it's available to anybody if they want to. And I see Farasha, she's one that attends all the time. She's it's one for anybody. I mean, so my mother is 92 and she's in there. Brenda, she's, I'm not going to say everybody else's ages because I know my mother's okay with hers, but we're all, 60 and above. And we're working out and we're doing our exercise. And I mean, it helps with our energy, it helps with the balance and all of that kind of thing. So anyone that's listening that is thinking, well, yeah, I can't go to the gym, or I can't exercise, or I'm not motivated to do it by myself. That is what it's for, from 7 to 8, about 8 o'clock. And we just do different types of workouts to help, keep the body moving. Okay, I wanted to put that out there. So if you're thinking, oh, I can't do it because of this, that's not true, because this is available for you and it's absolutely free. So, okay, so I want to talk about chiropractic and innate intelligence. What can you tell me? Because I hear you putting those little key little gems out there about love, and you mentioned being in tune with our bodies. I don't think everyone really understands the importance of really listening to your body. How can we do that if somebody doesn't even know that we have power within? How would you get them to understand, okay, you really do. We all do.
So, innate intelligence is one of those things you hear people talk about sometimes, and it can go way over your head, and you're like, oh my gosh, they're in this spiritual, like hippie, whatever vibe. Tune all that out while I'm explaining this, and try to just really like comprehend what I'm saying and where I'm coming from. So, innate intelligence basically is the belief that your body can heal itself. And if you think about, even right now, all of us are breathing. We're not literally telling our body, okay, take a deep breath in, take a deep breath out, and then keep doing that for me. Your body naturally does that, right? Just like your organs in your body are all naturally already working. Your stomach is digesting, your brain is maneuvering. So many different things are going on in your body, right? That being said, your body already has the tools that it needs to heal itself from dis-ease and from illness, which is why whenever we get sick, we get a fever. A lot of people are like, oh man, I have a fever, my body's not working. No, your body's doing exactly what it's supposed to do. That fever, that rise in temperature is helping your body try to fight off that bacteria and that infection that is present in your body. Now, kind of the challenge and the complexity that is present with that innate intelligence is nobody has the same body and the same DNA. We are all different. We all have different spines. We all have different DNA. We all have different chemical makeup, matter, down to the cellular level. So, what might work for me absolutely probably is not going to work for the next person and might not work for this person, which is why whenever you go to the doctor, it is important for you to be able to explain what you are feeling, what you're going through, and to truly listen to your body. Because on the flip side, us doctors are taking what you're telling us, and we're trying to come up with the diagnosis. About 80% of our diagnosis comes from the history that we take, the questions that we ask, and the things that you tell us. So the more in tune you are with your body, the better it's going to help you receive a more accurate diagnosis and the help that you need. And then it's important to listen to your body, because even as you were sharing, Beverly, talking about some of your story with your husband, right? He was over here like, nah, like this is not right. I'm feeling XYZ in my body. And the providers were so quick to brush him off because they weren't listening to him. Sometimes there are providers that unfortunately do think, okay, I'm right. I know what's going on. I did all of this schooling, XYZ. But I think what makes a really great provider is somebody who's able to put their ego and their pride aside and be like, okay, I'm here more so as an advocate for these people. Let me listen and let me see what is going on with their bodies. And that's why I'm also not afraid to tell somebody if I get asked a question, or I'm presented with something where I might not know the answer. I'm not gonna BS and be like, yeah, I think it's da da da. I'm gonna be honest. Hey, I'm not sure. Give me a little bit. Let me go research this for you. I'm gonna come back to you with all my research, and then we can come up with the educated solution together.
Wow, that was key. The
Mm-hmm.
fact that doctors shouldn't know everything, and that it's okay to just come and say, okay, well, let me research that. So if anybody listening, if your doctor says, okay, well, let me find that out, then that's somebody you really need to hold on to, and then let me know who they are so we can put them on our list. You mentioned fever.
Mm-hmm.
So being a mom, that's something I combated with for the longest. Whenever my kids would have a fever, part of me knows that, okay, the fever is fighting the infection. But then another part of me has been educated, I'll call it, to stop the fever if it's 100 or if it's 101, because, oh yeah, you don't want her to have a fever. So I know I combated that a lot, where I'm like, okay, where is it? What temperature should I be concerned where I give her something to lower the fever? And what temperature should it be where it's okay, it's fighting?
So I think you were more so acknowledging like, okay, a high grade fever of anything probably greater than 100, 101. Like, let me be more cognizant of, what's going on with my child. Also, I think that naturally women, mothers, we are very, I'm not a mother, but women, we are very nurturing, right? So naturally you're going to want to try to take somebody's pain away, try to help them, etc. There are different chiropractors who feel strongly about medication, period. Some are like, oh, don't take any medication. Medication is bad for you, blah, 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 blah. I'm one of those chiropractors who, again, I believe you need to do what is best for you in that moment. So if it's like, okay, I can sleep this fever off and let my body fight it naturally, cool, great. If you feel like, man, I can't, this pain is awful, I can't function, I need to take some Tylenol just so I can go to sleep, okay, do that just for that moment, but make sure that you're putting the emphasis on the rest, on the hydration, on putting nutrients back in your body to get your body feeling better.
Love that. Yes. So can you discuss like the disproportionate amount of people in the black and brown communities that have different kind of ailments or diseases or different things like that? Why is that the case and what can we do about it?
Yes. So, um, this is kind of a heavy loaded question because there's so many different moving parts. I think the bulk of the reason why we tend to have these common trends in our communities comes down to our culture. You know, the food that we grow up eating, that we learn how to cook, the recipes that we pass down, and the other things that kind of come with the culture. I know in my family, regardless of what was going on, if somebody passed away, if it was somebody's birthday, if it was the holidays, a family reunion, everything would literally turn into a function in the front yard. And there would be lots of liquor, lots of partying, lots of good food, dancing, a great time, right? Um, but I say all of that to say, right, that sometimes those moments, those pivotal things that we cling to that bring us so much love and happiness, might also not be good for our bodies because we're just putting all of this like poison and all of these bad things into our bodies. But at the same time, if we think about where some of these, um, the where and the why with some of these recipes and kind of why we started even eating like that in the first place, a lot of it stems back to slavery and the food that we were given, that we were forced to be able to kind of turn from nothing to something. So I know that Black culture, we tend to value that, and we tend to be like, you know what, like I'm going to embrace this struggle and I'm going to eat this or cook this because my ancestors did the same thing. This is what raised us, this is what brought us here. So I understand all of that there too, but it's kind of like a matter of having a healthy balance, right? I'm not saying nobody's perfect, right? So you're never gonna eat perfectly clean for the rest of your life. You know, you have to do things in moderation if you have to. I think that a lot of it just stems down to being a little bit more mindful, again, about what you're putting into your bodies. But that's why we tend to have those common trends of high blood pressure, diabetes, high cholesterol, lots of different things. And then also, when people say that, oh, this is genetic, you're at a higher risk of getting high blood pressure because your dad had it and because your grandfather had it and because your brother has it. We're more so not saying that you're not carrying a gene that can make you more susceptible to developing that. But again, I think it comes down to those social habits that you're watching, that you're subconsciously processing in your body, and then doing and implementing into your own life too.
Oh, I agree with that 100%. I was listening to, I think it was Lipton, Bruce Lipton, I believe. He's a doctor that wrote a book, and he had mentioned that it's like less than 5%. The inherited ailments or whatever that we get is less than 5%. I was like, geez, is that right? I can't remember what the percentage was, but it was way less than 5%. But I'm saying 5% just to be a little generous. But I'm so glad you
Evelyn,
mentioned. Uh huh.
I'm sorry.
That's okay.
She is absolutely right. Genetics doesn't define anything for us. There's a reaction in Zoom that if y'all are agreeing with what she's saying, give her some love by sending her a heart or something. So let's, stay on mute, but let's give her some reaction because this is phenomenal information. Thank y'all so much.
Yes, yes, absolutely. And we're going to give her information at the end so you can communicate, you can get in touch with her and support her business as well. But she mentioned slave food, and you took the words right out of my mouth because I was going to mention Black Health Matters. The author of that was on our call at one point, and I was reading his book, and there was a point where he was talking about the slave food and how there was food that was given to the slaves that was like the ham, the food that they didn't want, like the intestines and the pig's feet and things that they didn't want to eat, and that became soul food. Like you mentioned, it's something that we kind of grabbed hold of. Okay, well, this is soul food. My ancestors and okay, but it was the slave ancestors. It was not the soul food of the real, who we were in the beginning. It was more of the healthy food, the earthy type food that we ate in the past, like originally, and that's what we thrived off of. So I'm so glad you mentioned that.
I think it is so important to know your history. So with all of my accolades, I also ended up getting my minor in Black Studies when I was in undergrad. And it kind of was like the sector of lots of different things. I got a certificate in multicultural studies, all these different things, just because I wanted to really understand things that we don't learn in school, especially in today's society where they're trying to wash away our history and brainwash us, and they don't want us to know about who we are and who our ancestors were and where we come from. Like, it's really important to be able to understand the why behind some things, so then you can start to kind of change your mindset and be like, okay, all right, now that I know this, let me go change XYZ. Also kind of stemming from that too, something that I realized in chiropractic school that a lot of some of my now colleagues as well started to understand and started to ask in classes and stuff, and like physiology courses, is sometimes, I mean, most of the time too, African Americans, we can have a different physiology and a different anatomy than our counterparts sometimes. And because of that, right, you have to be able to make sure that the provider that you're going to can be like, okay, if I have a highly melanated person here and they have this skin lesion, if I can't visibly see it, can I acknowledge, all of the other symptoms that they might present with that'll let me know that this is going on? Can I tap into what isn't visibly there?
Yes, yes, I love that. All right, there's another question. Doc, can you speak on the benefits of chiropractic care and the immune system and boosting to decrease symptoms of on virus like cold and flu?
Yes, absolutely. So, because we are impacting your nervous system, because we are removing any joints that specifically in your spine, any vertebrae that is literally like kind of pinching and suppressing your nervous system, what happens is, right, let's say your brain is trying to go through your spinal cord and is trying to tell something in your body to go function. Hey, let's go here, let's go, to our immune system and go do this, and you have a huge misalignment in your neck. That signal from the brain is going to get stuck right here, right? So with chiropractic care, by us removing the misalignment and putting things back in place, your nervous system can have that natural flow, which is why over time you can start to see benefits in your immune system. It's not something that happens night and day. It is something that definitely takes time. Usually, by the time you start to get closer to the true wellness stage, where okay, you've been receiving chiropractic care for X amount of time, your body's used to holding the adjustment, it's used to now being in alignment how it was supposed to be, then you're going to start to notice all of these crazy benefits. Wow, I'm sleeping better. Wow, my immune system is improving better. My digestion is better. I'm having less headaches. I'm experiencing all of these different things. And then as far as boosting the immune system to decrease symptoms like cold, flu, that type of thing, you can take supplements, or again, just be more aware of like what you're putting in your body. Boost your turmeric, your vitamin D levels, zinc, iron, vitamin C, and then also if you go get adjusted too, it's going to speed up the function of your body as well, and help your body to fight that infection off.
I notice whenever I get the chiropractic care and I get cracked,
Mm-hmm.
it just feels afterwards. It feels good.
It
It's
feels real
like,
good in your
oh,
back.
right. It's like
Yeah.
it loosened up something. I don't. It's interesting. Someone asked me to speak on, I don't know how to pronounce this, Sogren and migraine headache.
So migraines, migraines can be caused from lots of different things. You have multiple different types of headaches. You have tension headaches, cluster headaches, you have cervicogenic headaches. You have so many different types of headaches that can be caused from different things. So, usually with chiropractic care, what we are doing is how we help the headaches is because usually your very first vertebrae that ends up getting extremely misaligned whenever we're sick, whenever we have sinus issues, whenever we suffer from chronic headaches, and those blood vessels that are associated with that vertebrae are going straight up to the brain. So that's why whenever we start to remove that compression against that the nerves in that area and we start to open up that joint space, why over time you can start to experience benefits from the chiropractic care pertaining to your migraines. Sometimes I think people think, okay, I'm going to get this one adjustment in my neck and then my migraine's going to go away. The opposite generally happens. You come to a chiropractor, we adjust your neck, your migraine intensifies before it kind of goes away. And that's also due to the fact that you need to make sure you're staying hydrated. I always encourage patients who suffer from headaches and migraines to drink coconut water because coconut is anti-inflammatory. It's also going to help replenish your electrolytes, help hydrate your brain, to really prioritize rest, and to just make sure that you're staying on top of everything in your body too.
Okay. Yeah, that coconut water is just unbelievable. Does stretching help prevent sciatica nerve attacks?
Stretching doesn't help prevent it, but it can help you manage it, right? Because by the time you're starting to experience sciatica, again, by the time you're starting to feel any sort of pain anywhere, the damage is pretty much already done. The dysfunction is already done. Something has been brewing there for a while to where your body is starting to feel it. It's not something that happened overnight where you just woke up, man, I woke up out of nowhere, the sciatica came, something happened last night. No, whether that's due to an injury that happened in that area, whether that's due to degeneration or arthritis, whether it's just due to compression and inflammation in that area, that is something that you would find out once you start to see a chiropractor. But stretching your piriformis muscle, if you guys look up sciatic nerve flossing, on YouTube, on Google, on TikTok. Those are different stretches that kind of help you manage some of your symptoms at their worst, kind of between your visits with the chiropractor.
What about knees clicking and popping, one worse than the other? Sometimes it takes effort to get going after sitting for a while.
So whenever your knees are clicking or popping, that can be a sign that there's either some sort of restriction going on in that area in the knees, meaning your joints aren't moving like they're supposed to. Sometimes it can be due to the joints kind of rubbing on each other. So with chiropractic care, what we do, regardless of if I'm treating the knee, I'm treating the low back, I'm treating the neck, if these two are the vertebrae and then there's a disc between here and things are compressed, or it's a joint space and things are compressed and almost touching, we are opening that up to create space to allow things to breathe. And that's very key and very important because, again, you have fluid in your joint spaces. And you need to be able to move in order to allow that fluid to properly hydrate the joints. So in my clinic, I treat all extremities, shoulder problems, elbow, wrist, ankle, knee, foot. I also treat anything in the spine.
Okay. So I have a question about that, a second part to that. In our exercise, I'm constantly looking for different types of exercise for us to do. And something popped up where there was a woman that was squatting. And she was talking about the importance of squatting and how it helps with the knees and the back and all of that. Have you heard anything about that or no?
Yes, I think what she's talking about is more so squatting is strengthening your quads and your glutes, which are important for removing any stress that is on your knees, and also any stress that is on your low back as well. So I think a lot of people don't understand that your body is connected, not just by, yes, you have all these different muscles in different areas, but there is a tissue called fascia that is on top of all of your muscles, ligaments, tendons. It's pretty much directly underneath your skin. It's kind of the consistency of, if you think about like a pantyhose and how it's woven and mesh and finely knit, that is what is on top of all of your tissue. That's what connects everything in your body. So let's say one of your knees is weaker and it's having issues and it has an injury or something to it, that's absolutely going to cause a shift in your pelvis, which is going to cause other stuff to kind of change in your low back. You're going to have different patterns that kind of present in your body. So whenever you start to do things like squatting, even if it's just a body weighted squat, and you start to pay attention to the biomechanics, meaning the form, making sure, okay, when I squat, are my knees shoulder distance apart? Are they pointing outwards? Are my feet pointing in the same direction? When I'm squatting down, am I engaging my core? Is everything kind of in a straight line? That's kind of teaching your body how to work together. And it'll also expose kind of where your weaknesses are, where your asymmetries are, your muscular imbalances are. So then you can start to be like, okay, yeah, I need to really start to do more isolated quad workouts on this side of my body to strengthen this, so that way my squat can be better, so my body can function better.
Okay. Now the squatting I'm referring to is like the Japanese squat. I don't know if you've seen like Asian women. They might be older and they're squatting. I mean, where they might be sitting on. And the reason I know this is because my mother went to Japan, and she was saying that they were sitting on the subway and they were just sitting in a squatted position, like all the way down, and just sitting there like that.
Okay. I'm seeing what you're talking about. Okay. Okay. Um, I'm not sure the science behind the Japanese squat specifically. But I do know also we can store certain traumas and emotions in our hips and in certain areas of our body as well. So it could be that it has something to do with kind of opening that area up to help relieve some tension in your body as well. When I say squat, I'm thinking about like your traditional, just straight up body weighted squat, or a squat that you see people do with the barbell behind them. Doesn't even have to have weight on there. A body weighted squat can be just as powerful as a squat with weight.
Okay, that's good to know because I was kind of concerned about the squats hurting the knees even more, but it can actually help if done right.
If done right, and if a squat hurts your knees whenever you perform it to where it's like extremely unbearable, there are other quad strengthening exercises that you can do that a chiropractor or a PT can prescribe you and implement in your treatment plan to help you get the same benefit from strengthening your quads. So I have patients who have a history of patellofemoral tracking syndrome, or some sort of like weakness, knee injury, meniscal injury in their knee, excuse me. And we've had to kind of get a little creative with some of the exercises that they do because they straight up cannot perform a squat. Okay, let's do a wall sit for 20 seconds, and then we're going to start to push you to do it for 30 seconds, 45 seconds, a minute. There are different things that I could do by having them put like a little ball between their knees and extend their legs out and squeeze and hold the ball in place. Doing single legged squats, or even things like glute bridges, hip thrusts. There's lots of different variations that you can incorporate to get the same outcome.
Now, is it possible? Because I know my daughter she used to do volleyball, and every now and then she'd have an injury, and I think it was her shoulder or something. It was one of her joints that she was having issues with, and they started doing exercise on a different part of her body because they said it wasn't strong enough, and that was why she was having the problem with her joint. Is there a possibility for that to go on with the knees, where maybe another part of
Absolutely.
our body's not strong enough?
Absolutely. So there are different joints in your body that are complex. Your shoulder, your hip, those are probably the most complex joints in your body because there's so many different connecting pieces, different muscles, ligaments, tendons that are in there. Same thing kind of with the knee. So yeah, you might be experiencing your pain in the knee right here, but again, our bodies are smart. Our bodies were made to adapt. Our bodies know how to help with healing and how to facilitate different things. So your body knows, okay, yeah, there's an injury right here in the knee. Man, in order for us to stay up, all these other parts have to kind of wake up and work a little bit harder, which is why those muscles might be way tighter on that side of your body, because they're working a little bit harder to basically help your body stand upright and move around with that energy or with that deficit in place.
Now, I don't know if you can answer this as a chiropractor, but as a mom, let's say you had children, would you take your child to a chiropractor like what you're saying, in lieu of a pediatrician, a primary care doctor. You know, I have to go every because I noticed whenever I used to take my kids to the primary care physician, nothing's really done. They just check this or they check the vitals, and that's it. And then they send them on.
I would take mine to both. I would absolutely take mine to both. I think there's a time and a place to go to a pediatrician or to go to your primary care provider. I know in the state of Texas, chiropractors are not considered primary care providers. However, where I went to chiropractic school at in Florida, you are considered a primary care provider. So that being said, because we can't fulfill that for you here in Texas, absolutely still make sure you're taking your child to go get their checkups, make sure that everything's good with them, but also go take your child to the chiropractor. We can also help with other things, especially if you go to somebody who is like board certified in pediatric chiropractic. Let's say your child has a chronic ailment going on, like they have a tongue tie, or they're walking funny, they're a toe walker, they're not crawling, they're not doing what they're supposed to do. You can absolutely help your child the most by taking them to go be seen by a chiropractor.
Wow. Wow, this is really eye-opening. So there's still a bunch of questions in the chat, but I wanted you to address one last thing before we address those questions. We were going to talk about plants and holistic healing as a complement to, getting rid of these ailments or, controlling these ailments and things. Can you address that a bit before we go on to the next?
Absolutely. So I am not a plant medicine expert, but I do deeply respect holistic traditions. And what I can say is herbal medicine is very, very, very powerful. I think the reason why this ties into holistic medicine so well, a lot of people, they have this misunderstanding of holistic medicine is all of that spiritual, like BS. No, holistic medicine basically is where you're looking at your body and your being as a whole. You are looking at everything that is affecting your body. You are looking at, okay, I'm looking into my diet, the things that I eat. I'm looking into the way that my negative thoughts are also affecting my body. I'm being more aware of how my mental state is feeling. I'm being aware of how much exercise I'm getting, how much sunlight I'm getting, how much sleep I'm getting, all of these different things. You're looking at your body as a whole, how stress in every way, shape, and form affects your body and your life. So, that being said, it makes sense if we have this innate power where our body already knows how to function and how to heal and how to do all of these beautiful things. And then you take something that is grown from the soil, from the earth, that God is making sure He is providing nutrients and sunlight and water to for it to grow and flourish, just like He did with us whenever He made us. It makes sense why plants are so powerful in healing your body.
Now, before I actually had this conversation with you today, I would have never even thought to ask this question. But somebody suffering from depression or something like that, can they go to chiropractic and that could actually help?
Absolutely. I've actually experienced an adjustment where life was hitting me, and I'll kind of share what I was going through. So I was a chiropractic student. I think I was in the middle of like midterm exam week, and my brother ended up going back to prison, and I found out like right before one of my exams, and I was so upset. I remember just being in class, I was numb. I'm like, man, I don't want to take this test. I don't want to do anything. Like, and I just was thinking about how powerful, a upper cervical or neck adjustment can be, and some of the benefits that it can bring. Like, yes, after an adjustment, you can get those feel good endorphins and all of those things as well. But also, the adjustment is helping you to release some of the trauma that you're feeling and help to bring ease to your nervous system. So I remember I went up to my professor. I didn't tell him by any means what I had going on, but I was just like, hey, like, I think I went in between classes or something. I didn't even care what he had going on. Pulled him aside. Hey, Dr. So and so, I'm really going through it today. Can you just really give me an intentional adjustment? He gave me such a good adjustment that like when I got to the car, I cried after, not because I was um more sad or anything, but because I was able to have an emotional release and I felt like I actually was able to see and feel in the midst of all of that numbness and in the midst of the hard time.
Wow. Um, yeah, you have put chiropractic services in a totally new light for me. So I could just imagine for our listeners, if you or anybody that's interested in doing chiropractic, please or joining with you, can you give them your information and also what you just shared in the chat?
I will put my information in the chat so you can follow me on Instagram at Yvonne Chiropractic Inc. And then my website is yvonnechiropractic.com. You can reach out to me via DM. My website also has all of my information. I have my link tree in my bio that will allow you to either give us a call, to look at my website, to schedule an appointment, all of that good stuff.
Awesome. Okay, now I'm going to put you on the spot for a
Please.
second, Dr. Jada. If, let's say, if some of the Sunshine family called you to set up an appointment today, tomorrow, maybe the rest of this month, January, is there a special discount that you can give those? It could be just
Absolutely.
today.
Absolutely. So I can give you guys a discount of, instead of the first exam being 150, I can give it to you for $99. I absolutely
Wow.
wholeheartedly believe in just again standing in my purpose, living in my purpose, and I can already tell just from this call that a lot of you guys just want to know what is going on with my body and how can chiropractic care help. And if I'm able to be that person for you, I would love to. So if you are on this call, you can absolutely send us a DM, or whenever you call to book the appointment, in the voicemail, just say, hey, I was on the call with you in Sunshine and Wellness, and I will absolutely honor that.
Awesome. Well, thank you for that, Dr. Jada. And thank you so much for your wisdom and your heart with us. Um, you've blown my mind, honestly. I was expecting, a nice call where we get this information, but you have truly blown my mind, and I really appreciate you being on here with us.
Thank you so much. Thank you for allowing me to share some of my knowledge with you guys and my light. I don't take that for granted. And if anybody has any question about anything, definitely send me a chat or a message. Also, depending on what your question is, might help me be like, oh, okay, let me make some content on that and really, make an educational video or a post or something to help out other people.
Awesome, awesome. Well, you're going to be hearing more from me, probably in your office and also here with Sunshine and Wellness. So again, thank you so much.
And to everybody, thank you for being on the call, and uh, hope everybody has a good rest of their weekend.
Thank you, and we'll be talking to you soon.
All right, bye.
All right. Okay, and don't forget we have the workout class free for everybody. It is from 7 to 8 o'clock. This is where we get our workout on. It's on Zoom. You just join in. We have the strength exercise, balance, qigong, and then also we end with meditation. So just come on. If you have any questions about it, just give me a call, 281-891-9903. I'd be more than happy to discuss it with you. And like I said, it's free, absolutely free. So you have no excuse if it comes to exercise and working out. Okay, I think I've covered everything. If not, then just give me a call. All right, everybody. Peace and love. You guys have a beautiful day. Whatever you do, love yourself and love somebody else. Peace and love.